In this tutorial, we're going to be talking about how to overcome or recover from a disc bulge. So what we're going to look at first is what is a disc bulge, and we're going to differentiate between, as you can see on the diagrams here, a normal disc, a bulging disc, and a herniated disc. Then we're going to look at a sort of an exercise that is regularly used, but you might want to have second thoughts about it. And that's in part 2, and then in part 3 we're going to look at what might be a slightly more effective exercise to start doing, and I'm going to obviously rationalize this and sort of justify why I'm saying this. I've taken the information from low back disorder, so that's a sort of a textbook by Dr. Stuart McGill, who's probably the leading authority on lower back pain. So that's where the information comes from, so it's not just me making it up as I go along. And this little piece of information here was off, I can't remember the website, but it was like a Mayo Clinic or a Mayo Clinic type website. So we're going to start off by looking at what is a disc bulge. So they occur when there is damage or weakening to the structures of the annulus. So what the annulus is you can see here, disc annulus here. So that is basically what I would describe as like a fibrous wall that goes around the nucleus pulpus, which is like a jelly-like fluid on the inside. So this damage allows the nucleus pulpus to move beyond its normal position on the inside of the disc. So you can see it on the inside of the disc here. So what basically happens is these delaminate, they weaken, and then what starts to happen is it starts to move from where it normally is, and you can sort of see that movement happening here. Now with a bulging disc, the outer layers of the annulus are still intact. So this is when we talk about bulging versus herniated, and the nucleus is still contained within the disc. When the outer layers of the disc are damaged, the nucleus escapes from within the disc, and it's called a herniated disc. So we come on to these two diagrams here. So the herniated one is where it essentially breaks through the wall and then touches the nerve, creates a pain, and the fluid sort of escapes outside of the disc. Whereas the bulging disc, it's still within it, it's just not in its normal position, which would be here. It's the disc, or the layers of the disc have delaminated and it's been able to migrate through, still intact, touching on a nerve, and then we get the pain that comes out. So that is essentially what a bulging disc is. What we're now going to look at are the sort of the recovery process of it, and then why we then need to go about minimizing certain exercises for it and start doing other ones. Before we get into the two exercises, just want to finish off this section by talking about, let's just say, like the natural healing process or that can happen with a bulging disc. So the majority of disc bulges can shrink over the period of 2 years, as well as the symptoms. So as we talked about, this migrating fluid on the inside can start to, let's just say, remigrate itself back, which will then take the pressure off the nerve and then reduce the bulging of the disc and the symptoms, because it's not touching on the nerve anymore. So why does this happen? Well, material is reabsorbed. Material becomes dehydrated, macrophages digest the material, so they're part of our immune system, which go around picking up debris or foreign objects that it essentially doesn't want there, and then it's able to sort of take that away to be disposed of, let's say. And then the inflammatory response causes digestion of material. So we've got that, let's just say, natural healing process. So what we're now going to do is talk about some things that we can do to help that process move along and, you know, not give the body as much work to do on its own. So we're giving ourselves the best chance to overcome a bulging disc. how to speed up healing of a bulging disc. This is part 1, and then we're going to talk more about a different exercise, or slightly different exercise, in part 2. So the normal approach that you might be told to do is what's called a Mackenzie approach, or Mackenzie method, and it's known as the floppy push-up. So the floppy push-up is essentially, you can see me in this diagram here. I've got my hips on the floor, knees on the floor, feet on the floor, and then what I'm doing with my hands is lifting my body, or lifting my chest up off the floor, which is then in some respects extending the spine and causing so this is the let's just say the back of my spine, this is the front of my spine, so I'm causing the back of my spine to be compressed together, which will in some respects, as it says here, to drive material forward. So it's driving the material, because it's squashing the front, it's driving it more towards the back, or this is the idea as well. And it's creating a vacuum. Now this has been shown to work in people that have 70% of disc height remaining. So if we've got some degeneration to the disc, then it's not going to be as effective as if we've got the majority of the disc height there. So we're looking at 70%. But there's also potential for facet joint damage due to the dynamic nature of the exercise. So the facet joints, which you can see on this diagram just about, basically you've got the vertebral body here. So this is the body of the vertebra. You've then got these spinous processes. Now, between spinous process, let's just say 1 and 2, they join. And this is the facet joint. So not only are we squashing the 2 vertebrae together, we're also squashing down on these facet joints. And this can cause a problem within the facet joints. So where there is let's just say value and some reasons to do an exercise like this, it might not be this exact specific one done in this exact and specific way. There could be a slightly more effective one. So this one could be damaging the facet joints. The facet joints are between 2 vertebrae, and the repeated extension also increased deterioration. So again, this information comes from Low Back Disorder, written by Dr. McGill, who is the sort of, let's just say, the world leading authority on lower back pain. So what he's not saying is, he's not saying there is no value to this exercise. He's just giving you an understanding that there is okay, it may be helping with regards to the disc material being allowed to move back to the center of the disc, but there are drawbacks to it, there are limitations to it, and there are some potential reasons why we might want to slightly modify what this is doing. And that's where this slightly more modified approach comes in. So I would describe this as a more effective approach. So we're still lying on the front, so we've still got hips, knees and feet on the floor. That bit is exactly the same. All we're doing is we're just not extending the spine as much. Now the reason we lie on the front is because it allows gravity to do its thing. So gravity will just allow the disc material to move back towards the center. We're also doing it in a static posture. So we're not, like the floppy push-up, going up and down, up and down, up and down. So we're doing it in a static way. Now, as you can see on the diagram, I've got one fist on the floor with my chin on it, and then I've chosen 2 fists with my chin on it. And that's just going to extend my spine that little bit more. So with that extra bit of extension, we are still, so if I just draw the back of the vertebra on there, and then the disc in between, we're still getting that compression on the posterior part of the vertebra and of the disc. But because it's a lot milder, it's not affecting the facet joint as much, which will be off the spinous process that comes off the back spinous process that comes off the back, and then you've got the joint that goes in between them. So it's a lot milder. So this is helping drive the material forward in the disc by for two reasons. So we've got the gravity, which is just allowing gravity to do its thing, and just naturally it sinks back down into the middle of the disc. And then we're also reducing further trauma to the facet joint. So we are essentially we're using the same principles, we're using essentially the same exercise, but we're modifying it to take away the dynamic nature of it, which is going to be worsening disc deterioration. We're taking away the extreme spinal extent or lumbar extension, which is then reducing further trauma to the facet joints, and we're allowing gravity to do its thing, and the let's just say the compression on the back of the disc to allow the disc material to move closer or move back towards the front of the disc into its natural position. So this exercise is one of the exercises that could be, as long as you know you've got a disc bulge and you know that's the problem and that's causing the problem. Another thing to be mindful of is when you are in that position, does it relieve your pain? If it does relieve your pain after 2 or 3 minutes being in this position, then it's starting to have an effect. And then if we can do this exercise plus build the torso, manage the movement, so on and so forth. So this isn't the only thing to do. There are other things that are worth doing, and obviously, if you want to have my help and my coaching doing that, we can get you going on some online coaching sessions where I can take you through the online consultation and self-assessment. We'll get an understanding of your back pain, what's triggering it, what's making it worse, and then we can start putting in place the relevant exercises, stretches, any rolling, or any advice and recommendations with regards to movement, so on and so forth, to help build your torso so you can overcome your lower back pain. So hopefully this has been helpful for you. Hopefully it's given you a better idea of how to reduce and speed up the healing of a disc bulge. My name is Chris from Chris Training, and I will speak to you in the next tutorial.